Hi, my name is Brianna and today I'm going to tell you exactly how to apply for Medicare Part B if you delayed your Medicare. So maybe you turned 65, you picked up Medicare Part A because it didn't have a cost for you, but you kept your employer coverage. And now you're 67 and you're retiring from your full-time job, and now you need to pick up Medicare Part B. That's step one before fully getting out your Medigap plans and your Medicare drug plan. Let me show you how to do that. It's really super simple. So we're going to go to ssa.gov/Medicare/sign-up/Part B only. You can see the link right up at this top. You can also just Google apply for Medicare B, and it's that first thing that pops up. So on this page, you'll see where it says start an application. Because you already have Medicare Part A, this is super easy. You don't need to log in to Social Security. You don't need a password. We're just going to submit this application with one form. So we're going to click Start Application. Then you're going to see this instruction page. You'll know you'll need your Medicare number, current address, valid email, and this documentation that shows your group health coverage. So when you don't pick up Medicare Part B when you first turn 65, you need to have credible coverage or you will get a penalty. In this scenario, you would have had your group coverage through your work for the last 2 years. So you're going to need one extra form like I talked about to get that done. I'll show you what that is in just a moment. But for this one, you're just going to click I understand, and that we're going to start the application for Medicare Part B. So here is you have one page of instructions, then your second page, more instructions, and I'm just telling you about the different enrollment periods that you are going in. Your enrollment period is a special enrollment period because your group coverage is ending due to your retirement. That's why you can do this. You can pick up Medicare Part B for the first day of the following month of any point that your group coverage is ending. So even if it's the middle of the year, it's June, it's not near your birthday, you can still do this. So what you're going to do is you're going to put in your Medicare number. Again, you have Part A, so you put in your Medicare number here. You say, do you want Medicare Part B? Yes. You'll put in your name, mailing address, and your phone number. And then here in the remark spot, you can keep that empty, but you should probably put in your desired start date. So desired start date, let's say it's June 1, 2025. The second part is where you're going to put the employment information. So the place where you've been working. This is where I want to take a pause and show you that one extra form in which you'll need. So this is CMS L564, or the Request for Employment Information. This is a super simple form that your HR manager or the owner of the company that you've been working for will sign, simply stating, hey, Mr. Jones has had Medicare Part A and your group coverage. You've had credible coverage this entire time. So this will be, you'll put in your employer's name, how long you've been working there, their address. And here it gets a little confusing. There's an applicant name and an employee's name because they can be different. So say that you have been retired, but your wife has still been working. So the husband's retired, the wife is still working. They've been using the wife's health insurance. That's been their main health insurance. That's been primary, the wife's health insurance. Now the wife is retiring. The applicant's name would be the husband who is going on Medicare, but the employee's name would be the wife. So you put the applicant's name and their social, and the employee's name of the wife and her social. If she's also going on Medicare, she'll need her own form signed also, where she will be both the applicant and the employee. This second part is completed by your employer, so you don't have to do any of that. That's just saying, hey, yes, you guys have been covered on a group health plan since turning 65. And that's it. And then they sign it. They give this back to you. And then you can go back to this form where you'll put in the employer's name again, that you've had coverage the whole time. And then you will click here and you will upload that document to here. And then you click here and you will sign it all on here. And then you click submit and boom, you've applied and added your Medicare Part B. If they need any other information, they will reach out to you. If this gives you any bit of anxiety at all, I can walk you through exactly how to do this application on a one-on-one. We can do a Zoom meeting. You can also reach out to your local Social Security office, or I can send you the paper version of both of these forms and you can bring that in to your local Social Security office. Again, my name is Brianna Henward. I live right here in North Berwick, Maine. So if you have any questions on applying and adding your Medicare, let me know. The last thing I do want to mention, just because you've added Medicare Part A and Part B, you are not done. We need to add, at the bare minimum, you need to add drug coverage or else you will get a penalty later. And you should really consider a Medigap policy or a Medicare Advantage policy. Medicare Part B has a 20% that you have to pay that has no cap. This is exactly what I help with. I'm a completely free resource. If you don't understand any part of Medicare, please reach out. My number is 207-248-8411, or you can email me directly at Brianna@Tindon.us. Have a fantastic rest of your day.